CBT Sample Questions. Question number 1. What is the role of NMC? Option A. To represent or campaign on behalf of nurses and midwives. Option B. To regulate hospital or other healthcare settings in the UK. Option C. To regulate healthcare assistants. Option D, which is the correct answer, to regulate nurses and midwives in the UK to protect the public. Question number 2. What is the purpose of the NMC code? A. It outlines specific tasks or clinical procedures. B. It ascertains in detail a nurses or midwives' clinical expertise. C, which is the correct answer, it is a tool for educating prospective nurses and midwives. Question number 3. All are purposes of NMC except Option A. NMC's role is to regulate nurses and midwives in England, Wales, Scotland, and Northern Ireland. B. It sets standards of education, training, conduct, and performance so that nurses and midwives can deliver high-quality healthcare throughout their careers. Option C. It makes sure that nurses and midwives keep their skills and knowledge up to date and uphold its professional standards. Option D is the right answer. It is responsible for regulating hospitals or other healthcare settings. The UK regulator for nursing and midwifery professionals within the UK with a started aim to protect the health and well-being of the public is GMC, NMC, BMC, WC. The correct answer is NMC. Question number 5. Which of the following agencies set the standards of education, training, conduct and performance for nurses and midwives in the UK? The correct answer is NMC. The options are NMC, DH, CQC, RCN. Question number 7. The code contains the professional standards that registered nurses and midwives must uphold. UK nurses and midwives must act in line with the code, whether they are providing direct care to individuals, groups, or communities, or bringing their professional knowledge to bear on nursing and midwifery practice in other roles such as leadership, education, or research. What 4 key areas does the code cover? Option A. Prioritize people, practice effectively, preserve safely, promote professionalism and trust. That's the correct answer. And the other options are prioritize people, practice safely, preserve dignity, promote professionalism and trust. Option C. Prioritize care, practice effectively, preserve security, promote professionalism and trust. NMC requires in the UK how many units of continuing education units a nurse should have in 3 years? 35 units, 45 units, 55 units, 65 units. Correct answer is 35 units. Question number 9. The code is a foundation of dress code, personal document, good nursing and midwifery practice, and a key tool in safeguarding the health and well-being of the public. And option D, hospital administration. The correct answer is good nursing and midwifery practice and a key tool in safeguarding the health and well-being of the public. Question number 10. According to NMC Standards Code and Conduct, a registered nurse is excluded from legal action in which of these? Option A. Fixed penalty for speeding. Option B. Possessing stock medication. Option C. Convicted for fraud. Option D. Convicted for theft. The correct answer is option B. Possessing stock medications. Among the following values incorporated in NMC 6 Cs, which is not included? Care, courage, confidentiality, communication. The correct answer is option C. Confidentiality. Question number 13. A nurse delegates duty to a healthcare assistant. What NMC standards she should keep in mind while doing this? Option A. She transfers the accountability to care assistant. Option B. RN is accountable for care assistant's actions. Option C. No need to assist the competency as the care assistant is expert in her care area. Option D. Healthcare assistant is accountable to only her senior. Option B is the correct answer. Question number 40. Which of the following is not one of the 6 fundamental values for nursing, midwifery, and care staff set out in A Compassion in Practice Nursing, Midwifery, and Care Staff? A. Care. B. Consideration. C. Communication. And D. Compassion. B. Consideration is the right answer. Question number 15. According to law in England, UK, when you're faced with a situation of emergency, what is your action? Option A, should not assist when it outside of work environment. Option B, law insists you to stop and assist. Option C, you are not obliged in any way but as a professional, duty advises you to stop and assist. Do not involve in the situation. Option C is the right answer. Question number 16. According to NMC Standards, Code and Conduct, a registered nurse is excluded from legal action in which one of this? Option A, fixed penalty for speeding. Option B, possessing stock medications. Option C, convicted for fraud. Option D, convicted for theft. Option A is the correct answer. The code is the foundation of option A, dress code, option B, personal document, option C, the correct answer. Good nursing and midwifery practice and a key tool in safeguarding the health and well-being of the public. Option D, hospital administration. Option C is the correct answer. Question number 18. A patient has been assessed as lacking capacity to make their own decisions. What government legislation or act should be referred to? Option A, Health and Social Care Act. Option B, Mental Capacity Act. Option C, Carers Equal Opportunities Act. Option D, all of the above. Option B, Mental Capacity Act is the right answer. Question number 19. Under the Carers Equal Opportunities Act, what are carers entitled to? Option A, their own assessment. Option B, financial support. Option C, respite care. Option D is the correct answer, all of the above. Which law provides communication aid to patient with disability? Option A, Communication Act. Option B, Equality Act. Option C, Mental Capacity Act. And option D, Children and Family Act. Option B, Equality Act is the correct answer. Mental Capacity Act 2005 explores which of the following concepts? Option A, Mental Capacity Advanced Treatment Decisions. Act's Code of Practice. Option B, Mental Capacity, Independent Mental Capacity Advocates, and the Act's Code of Practice. Option C, which is the correct answer, Mental Capacity Advanced Treatment Decisions, Independent and Mental Capacity Advocates, and the Act's Code of Practice. The other option is mental capacity and the possible ethical and legal dilemmas in its interpretation. Option C is the right answer.